Welcome. My name is Peter Strong. I'm a professional online therapist and I specialize in mindfulness therapy for the treatment of anxiety and panic attacks, and also for working with depression and addictions, and also for OCD. So I'm often asked, what is the best treatment for anxiety and panic attacks? Well, from my experience over the years, it's quite clear to me that the best treatment there is mindfulness therapy. That is, learning how to apply mindfulness to work with your anxiety and help that anxiety heal. So the primary job in mindfulness therapy is healing the underlying fear and anxiety. So we go about this in a number of ways. The first most important principle that I will teach you during our sessions together is how to disengage ourselves from the reactive habitual thoughts such as worrying and rumination and patterns of negativity that feed the anxiety. This is something we do by developing mindful awareness to see those reactive thoughts very clearly and to break the habit of blindly identifying with them. Thoughts in themselves are not the problem, and they are not the cause of anxiety. But if we become identified with them, then they become a powerful fuel that feeds anxiety. So the first job in our path of overcoming anxiety and panic attacks is to isolate these thoughts, is to see them very clearly, is to find those habitual thoughts that feed our anxiety. When we find these thoughts, we do not try to get rid of them. We do not try to let go of those thoughts. That, of course, is a pointless exercise. They will simply return again. What we have to do is focus on helping those thoughts heal themselves, to basically resolve themselves so that they do not repeat and come back again. So we do this by learning to develop our capacity as the observer of those thoughts. So the more we become the observer, the less identified we become with the thoughts. And this basically neutralizes that habitual pattern of identification which causes the thoughts to proliferate and feed the underlying anxiety. So we learn to sit with our thoughts, with our anxiety-producing thoughts, without becoming identified and without becoming reactive. We take this a stage further. We not only sit with them and develop non-reactivity, or equanimity, as it's called, which is one of the principal features of mindfulness, but we also develop compassion and friendliness towards these anxiety thoughts. This is where the real healing occurs. So you can think of anxiety-producing thoughts as being rather like children that are in pain or suffering in some way. What they most need is our compassion, to be present with them without reacting, without becoming judgmental, without becoming hostile, but rather being with them with an attitude of love and kindness and patience and all the other qualities that are associated with compassion. So compassion is another essential component of mindfulness. If there's no compassion, it is not mindfulness. Also, if there's no clear, conscious, non-reactive awareness, there is not mindfulness. The two together are what constitute mindfulness. So we learn to be present with our anxiety thoughts, and then we learn to respond to them with compassion, really helping those thoughts heal. And this then starts to establish healing pathways in the mind that heal the underlying anxiety. We're taking away the fuel, and then we're helping the anxiety heal. This is the primary mission in mindfulness therapy for anxiety and panic attacks. So the practical way that we go about doing this is to develop our skills in mindfulness meditation, where we meditate on the anxiety. We meditate in order to build a better quality relationship with the anxiety and its thoughts that's based on conscious awareness, that's non-reactive, and compassion that helps heal those reactive thoughts. One way that we do this in our meditation is by seeing the thoughts as objects, really understanding they are not who you are. You are not your thoughts. You're not your anxiety. The problem is we think we are. We become identified, and then we feed that anxiety. And not only do we feed it, but we prevent it from healing itself. So when we can sit with our thoughts mindfully, we actually are learning to see those thoughts and the emotion as being objects in the mind. We become the observer of those objects, and that is different than the objects of thoughts or emotions. So by meditating with them, we are not only helping the anxiety heal and breaking free from these habitual reactive processes of thinking that feed the anxiety, but we are also developing this totally different side of our being, which is as the observer. So this is called the liberating effect of mindfulness. The more present you are, the freer you become from the anxiety and the thought habits that feed it. The freer you become, the more able you are to respond with wisdom and compassion that facilitates and accelerates the healing process. So meditation is the preferred method, the most effective way of healing anxiety and also panic attacks. Panic attacks simply refer to a very intense form of anxiety reaction. It's also habitual by nature, and it's fed by a constellation of reactive thoughts that feed that anxiety and intensify it. So we meditate on our panic attacks also. We learn to change our relationship to the anxiety, to the thoughts, so that we become freer and the anxiety learns to heal itself rather than simply proliferate itself through habitual reactivity. So meditation is very effective, much more so than medications. Medications simply mask the symptoms. It may dull the emotional pain of the anxiety, but of course medications will do nothing whatsoever to change the underlying habitual process that causes your anxiety or panic attacks. So meditation is attempting to really change that underlying process itself at a very deep and lasting way. So when we stop avoiding our anxiety and panic attacks through medication, but rather really focus on developing a conscious and compassionate relationship with our anxiety, then the rate of healing greatly increases. And most people that I work with start to see dramatic changes in the level of their anxiety within a few weeks of practicing the mindfulness methods, and including mindfulness meditation, that I will teach you in great detail during our online therapy sessions together. So if you're interested in learning how to effectively overcome anxiety and panic attacks, then I invite you to contact me and let's schedule a session. You will see changes even after that very first session, when you start to understand how to work with your emotions, how to work with them directly rather than escaping them or trying to avoid them in some way which will be not productive in the long run. So if you'd like to get started, please contact me. All my sessions are done via Skype. Skype is a very effective way of allowing effective communication, and it's really no different than meeting in person. You have to be able to see each other, and that's the most important thing that Skype makes possible. And when you can see each other, then the communication becomes very effective. And for learning mindfulness-based treatments for anxiety and other emotional problems, Skype is perfectly adequate. So please feel free to contact me if you'd like to get started and really make a change in your anxiety. Thank you.